Chirocate exercises. For this session I'm going to run through a few exercises for frozen shoulder, which is slightly different to the other shoulder injuries and stiffness and pain that you can be feeling. If you've had a diagnosis of frozen shoulder, you know you'll be quite restricted in your range of motion by now, and it'll be quite difficult to get anywhere near to that 90-degree angle here on your abduction or moving your arm out to the side, and really quite difficult to make it up to that 90 degrees of forward flexion of movement in front of you. So what we're going to do is start some exercises that stay within that pain-free range of motion. For frozen shoulder, it's really important not to push your shoulder past a comfortable range of motion. If you're doing this and you're pushing through pain or into pain, it's very, very likely that the shoulder re-inflames very, very quickly and locks down further. So it's supremely important to stay well within your pain-free zone, but just get some small and regular stretches going. Okay, so for your frozen shoulder, we're going to start with pendular exercises. So I'm going to use my left shoulder and I'm using an exercise ball to help me, but you can do this freestanding, you can hold onto a wall, whatever feels comfortable. What you want to do is move that arm in circular movements. We're starting with really small circles, moving slightly out and further, making bigger circles so that you're keeping your shoulder within its pain-free range of movement. I want you to keep this going for a good 2 to 3 minutes of just trying to get further and further and drawing big circles. Remember, no pain should be felt with this, but you should just be feeling that those circles are slightly challenging your shoulder. Okay, we're going to move on to wall walking exercises for the frozen shoulder. And the model is demonstrating her right shoulder. So what I would like you to do is face a wall and standing close enough for your right arm or right shoulder to touch that wall. So we're moving in the forward plane first. So with your fingers, you're going to be walking that shoulder up as high as you can towards that wall until you get to a point where you're just pushing that shoulder up into a really stretched position, and then hold for 10 to 20 seconds. And then bringing that shoulder gently all the way back down again. And now we're going to show the same exercise but sideways on. And this is the type of motion which is the worst in frozen shoulder. So it's called abduction, or moving that shoulder away from your body. So we're going to repeat this exercise. The right shoulder is coming towards the wall and we're walking those fingers up towards that wall, making the shoulder go a little bit higher. Remember, you're staying within your pain-free range of motion. Okay, now we're going to move on to some really good stretches for your shoulder using your kitchen or dining room table. We're using the chiropractic bed at home to demonstrate. So you want to be sitting next to your table, sideways on, and then just moving your arm forward and backwards. Going as far as you can, both sides, forward and back, and really kind of sit back into that stretch if you can. And again, likewise, you're aiming for a really good stretch, although you won't get this far with frozen shoulder. The next movement you want to do is circles. So we're circling around that shiny kitchen tabletop, round in one direction, and really pushing and making those circles a little bit bigger each time, and then reversing that movement, coming back in the opposite direction. Okay, I'm now going to move on to do some muscle release type work using a tennis ball or your thumb. So these are the areas that I particularly work into: sore, tender, dysfunctional shoulders or in frozen shoulder. So we're going to move first to look at the model's trapezius muscle. This muscle is the first muscle that should be relaxed or released when you're working a frozen shoulder. So what I'm going to do is find the uppermost peak of that shoulder muscle that sits here and either press very, very gently into it the patient here is feeling that tenderness, or use the tennis ball just gently into that muscle. Now, I'm not going to roll around. I'm going to keep a constant pressure just until that muscle releases and feels better. So it could take sort of 20 seconds, 30 seconds, 5 seconds, depending on how sore that shoulder is. This is the first muscle. Okay, so we've got 2 more muscles in this position that we want to do. Now, we're looking at the scapula that sits here, the shoulder blade. There should be quite a nice bony ridge that sits about here, which is called the spine of the scapula. So have a feel around. When you've found that bony ridge here, what we want to do is use the tennis ball or the pressure points at the end of this spiny ridge here. So I will be pushing again with the tennis ball in here until that area of muscle feels better, and then just popping up about 1 inch and sitting just at the top here into the top of this muscle. So I'm making sure that I'm just moving. I was a little bit low there. So here and then here. Okay, we're now moving on to use the tennis ball in the deltoid muscle, which is the muscle at the side of the shoulder here. Now, I like to start just above that elbow to catch where that deltoid inserts into that bone. But you can just start gently moving up the side of the arm until we find some of these spots that your patient will tell you are sore. We're then using the tennis ball into those spots. We're not rolling, we're not rubbing, we've got constant pressure on. And after 10 seconds, 20 seconds or 5 seconds, depending on how quickly it takes for that spot to feel better, then we move a fraction up, about 1 centimetre up to the next area, and hold again and release. And you're going to be working your way up gently and slowly all the way towards the top of the shoulder. Okay, I'm going to move on to another really important muscle in frozen shoulder, which is the biceps muscle. Now, usually when we're working the biceps muscle, we work the tendon, but in frozen shoulder, the whole belly of the muscle is also very tender, as well as that tendon that comes into the shoulder here. So we're going to start at the elbow joint very gently, either feeling the spots that first feel tender. I can feel a spot here that feels tender, and I'm going to use my tennis ball then to just press until the tenderness eases up a bit. It won't go away completely probably, but it will ease, and that's your sign to move on to the next spot. So we're going to keep that pressure. We're not rubbing, we're not moving, we're keeping a straight, firm pressure until that tender spot releases and feels a little bit better, and then we're moving on. Now with the biceps, you can move right the way up to the shoulder, and it'll often start feeling even more painful as you hit this area moving into the shoulder, but that's fine. I want you to move right the way up to this point here. Right, if you don't have somebody at home to help you, what you can do is use your tennis ball against the wall. So we're finding the same pressure points at the back of the shoulder and either side of the scapula or the shoulder blade, and we're finding ourselves those areas that are tender and pushing in using the tennis ball to release them. So again, use your own body weight, wait till that area feels a little bit easier, and then you can reposition yourself, that ball against the side of the shoulder and against the wall. You can also do this sideways on. So if we move to the side and we just demonstrate on the right shoulder, we can use this, if we're going towards the shoulder, right into that deltoid beautifully there. Or we can bring that arm forwards and come into this. This is a great spot here on the shoulder blade that can often give you a lot of release here. Just by that spine of the scapula again, a great rotator cuff muscle that gets very sore in frozen shoulder. Thanks for watching Chirocate exercises. Remember to click on subscribe, click on the bell for notifications, and feel free to share these stretches with your friends and family.